Nancy Kyle, President and CEO of Second Harvest Food Bank of Middle Tennessee, and David Alperson, Vice President of Amazon Logistics, who is joining us remotely by video conference. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. The pain and loss of the March 3rd tornado is still fresh for all Nashvillians. So our thoughts are with our neighbors in Chattanooga at this time, especially with the family of 4-year-old Grayson Meadows, who we've learned has just passed away from injuries he sustained in the Easter weekend tornado. Grayson's father, Mickey Meadows, remains in the ICU. Now, once again, I'd like to begin today's press briefing by reminding everyone that the Community Resource Center has already started receiving and distributing donations to the Chattanooga area. Anyone who can contribute at this time should visit the Community Resource Center's website at crcnashville.org to find a list of items that will help our friends in Hamilton County in their recovery process. We send our best wishes to all of those who are at home in Davidson County who are sick with the coronavirus, and we extend our heartfelt condolences to the loved ones of those who have died. I urge everyone to continue following the Safer at Home order so that we can further flatten the curve of COVID-19, and which helps support both our frontline healthcare workers and our first responders, and will save lives. Continue remaining at home whenever possible, and wear face coverings when social distancing measures are difficult to maintain as you run essential errands. Now, yesterday, the State Health Department opened additional testing facilities in areas that did not previously have testing capabilities. And Metro's community assessment system, which includes the COVID-19 hotline and multiple assessment centers, continues to make the best use of local resources to mitigate the spread of the coronavirus in Davidson County. Our system has managed to have high daily throughput volumes and offers a newly expanded list of COVID-19 symptoms to provide free assessments to everyone in Nashville and free testing to those who require it. Dr. Jahangir will have more details about testing policies at our community assessment centers shortly. Now, I want to remind everyone that Metro Nashville's community assessment system is available to everyone in Davidson County free of charge. And if you believe you have symptoms of COVID-19, please call the COVID-19 hotline at 615-862-7777, which is open 7 days a week from 7 a.m. to 7 p.m. And if additional assessment is necessary, you may be directed to a community assessment center to be screened and tested for COVID-19. All services at Metro's community assessment centers, including COVID-19 tests, are also free to Nashville residents. Community assessment centers are open at Nissan Stadium, Lot N, Meharry Medical College at 918 21st Avenue North, and the former Kmart site at 2491 Murfreesboro Pike in Antioch. And hours of operation for all three locations are 9 a.m. to 9 p.m. Monday, Wednesday, and Friday until further notice. Now, yesterday afternoon, Governor Lee announced that schools statewide should remain closed for the remainder of the school year. And I want to welcome Dr. Adrian Battle, Director of Metro Nashville Public Schools, who is here to give an important update about the academic support that MNPS students will receive during this time of social distancing. Also want to welcome Nancy Kyle, President and CEO of Second Harvest Food Bank of Middle Tennessee, and David Alperson, Vice President of Amazon Logistics. Nancy and David are invaluable members of Metro's Food Security Working Group and have joined us this morning to provide an update about this team's efforts to address the needs of individuals and families throughout Nashville. Now, I am grateful to all the members and organizations that are part of the Food Security Working Group, including MNPS, the Red Cross, Amazon, Kroger, Lyft, and local restaurant leaders such as Chef Sean Brock. They are working diligently around the clock to make this happen for us and to meet our food security needs throughout our community. Now, MNPS families, our homeless population, and our vulnerable residents, I'm especially grateful for the food security team for their efforts and dedication at this time. And as always, I urge everyone to visit covid19.nashville.gov to contribute as you are able to the COVID-19 Response Fund, which has been created to help Nashvillians facing hardships during this time. You can also visit the website to learn how to obtain direct financial, food, mental health, and social service assistance. And now I'll turn it over to Dr. Alex Shahanger, Chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest update on the COVID-19 virus in our community. We now have 1,560 confirmed cases in Davidson County, an increase of 68 cases over the past 24 hours. We had another death yesterday, a 70-year-old gentleman with underlying medical conditions. My sympathies go out to his family and friends. That is now the 18th death in Davidson County as a result of COVID. There are an additional 1,558 cases in our surrounding counties, bringing the total in our region up to 3,100. Of the 1,560 Davidson County cases, 865 are currently active, and 677 residents have fully recovered from the virus and have been cleared. Yesterday, the 3 assessment centers were open, and 370 people were screened and 329 were tested. This brings the total number of residents screened to 2,446 and 1,712 people tested since March 31st. The centers are open Monday, Wednesday, Friday from 9 a.m. to 3 p.m. As a reminder, the symptoms for if you're worried about are shortness of breath, cough, fever, new onset loss of smell, or new onset diarrhea. If you are worried, please call our hotline at 615-862-7777. The hotline's open 7 days a week from 7 a.m. to 7 p.m. Yesterday, we had 257 people call our hotline, bringing our total of people who've called our hotline to 4,549 individuals. Our medical personnel at the hotline will help determine if you need additional screening and will refer you to either your local healthcare provider or to one of our community assessment centers. Yesterday, as the mayor announced, announced the state expanding testing to areas that do not have easy access to testing like we do here in Nashville. I applaud the governor and the State Department of Health for their efforts to test more Tennesseans. From the first day Mayor Cooper formed the Coronavirus Task Force, we came together to make sure all Nashvillians received the assessment and testing needed. And now, for more than 2 weeks, since March 31st, we have been screening and testing our residents, all at no cost, and continue to broaden the indications for testing. I want to thank the many partners we have who have come together to make our community assessment system in Nashville work. Thank you to our health partners in HCA TriStar, Vanderbilt University Medical Center, Nashville General Hospital, St. Thomas Ascension, and Meharry Medical College. I also would like to thank Hands On Nashville and the many countless other volunteers who are helping at our centers. I truly appreciate their dedication and their showing of how Nashville cares for each other. Also, thank you to Metro Public Health Department, especially our professional staffing the hotline, as well as members of the Office of Emergency Management and the Davidson County Sheriff's Department, and all other Metro Nashville employees who have been involved. And most important, I'd like to thank you, Nashville. The sacrifices you are making are truly making a difference. The difference shows in the models, and as you guys have seen, we really have flattened the curve. So please keep it up. Stay at home and go out only if it's absolutely necessary. And if you do go out, please take precautions such as social distancing and wearing protective face mask when you're in public. And most importantly, if you think you have the virus, please seek medical attention and don't go out. Just self-quarantine. And remember, you have to stay vigilant in order to make sure that this virus does not spread. I really appreciate everyone's efforts, and now I'd like to introduce Dr. Battle. Thank you.
Good morning. Closing our schools for the remainder of the 2019-2020 school year is not the outcome we wanted. And of course, we would prefer to have our students in schools with us. But we've been expecting this, and we've been planning for it as well. As a result, we've developed a strategic framework to better serve our students over the next few weeks. That framework will serve us well not only now, but also in the future if another outbreak of COVID-19 forces us to close schools again. Our goal is to make sure every child has access to a high-quality education that will prepare them for the next school year. And we're going to serve, support, and strengthen every child. Education should always extend beyond the walls of a classroom and be instilled in the hearts of our students. Our plan will offer students stability, familiarity, comfort, community, and an opportunity to connect with their peers at a time when many are feeling isolated. So starting this week and next, our district's leadership team will be working with principals and staff to strengthen guidance and expectations for teachers and for students. And beginning April 27th, families can expect to see a stronger engagement and a more structured learning environment. This will not require graded materials or attendance that counts towards a student's record, but it will mean more feedback on student work so we can develop personalized plans for each child's success. We will be phasing this in to allow students, teachers, and families to adapt and adjust to a new way of doing things. And we'll be making laptops available to more of our students so they can fully participate. And we will also continue to distribute printed materials for students. We'll be sharing further details over the coming week. We plan to make decisions about graduation ceremonies and the best plans and ways that we will celebrate and recognize our students' accomplishments on or before May 1st. In the meantime, seniors, you should bookmark mnps.org/seniors for information about finishing and completing your remaining graduation requirements. There's a lot of work ahead of us. We're in uncharted waters, but I know this. Our district will not be defined by the challenges we face, but how we face our challenges. And over the past 6 weeks, from our tornado recovery efforts through our pandemic response, we faced those challenges with great creativity, determination, and resolve. I have been constantly impressed, inspired, and even amazed as our teachers and staff have stepped up to the challenge of serving our students educationally, emotionally, and nutritionally as well. It's a new day for our school district, and we're disappointed that the school year has to end this way, especially for our seniors who don't deserve this. But MNPS has already endured a lot of change and adapted in just 6 short weeks, and we'll continue to do that in the weeks ahead. Thank you. At this time, I would like to introduce Nancy Cowell, who is the President and CEO of Second Harvest.
Mayor Cooper, thank you for inviting me to participate in today's COVID-19 update. And we truly appreciate you and Dr. Jahanger's leadership and transparency during this difficult time. Last month, Metro created a food security working group to address the needs of our community. The starting group included representatives from the Mayor's Office, MNPS, the Red Cross, Kroger, Lyft, Amazon, and restaurant leaders such as Chef Sean Brock. Today, I'd like to take a few minutes to update you on our progress. The working group is focused on 4 areas. First are schools and families, community distribution points, direct-to-home delivery, and the homeless. Our initial focus was on schools and school families. MNPS has taken the lead on this area. They are now providing breakfast and lunches at 15 schools across our county, as well as 8 bus routes. You can get details on the MNPS website for more details. Their latest numbers show we have served nearly 6,000 families, distributed 8,700 food boxes, and 3,600 food bags. We have also worked to expand and create new food distribution sites. We have started at 5 schools: Antioch High School, Glencliff, Hillwood, McGavick, and Haywood Elementary. This week, we have expanded the distribution to include Camp Wiggewagon in southeast Nashville and to 4 community centers that effectively double the number of community distribution sites. The combined efforts will provide food to an estimated 2,050 households each week. I'd like to thank Parks Director Monique Odom and Stefan Nellums for all their support in making these community efforts this week. The Mayor's Office is also working with Planning and Social Services to identify additional areas of need, and we look forward to expanding in those areas in the weeks to come. In addition to the school and community center distribution sites, we are also working with Chef Sean Brock and a number of other restaurant chefs to provide prepared meals for those in need. Those meals will be served at Second Harvest partner agencies throughout the community. We will have more information on the Second Harvest website next week. Next, I'd like to talk about our homeless. Our partnerships with Sodexo and HCA feed approximately 250 individuals at the fairgrounds using food from Second Harvest. I'd also like to recognize Mike Kerb and his foundation for providing Chick-fil-A dinners for the remainder of the month. These partnerships collectively provide 3 meals a day, 7 days a week to our homeless population. We are also providing shelf-stable boxes to Social Services Homeless Impact Division for distribution to their community partners who are serving the homeless residents. Finally, I want to thank our private sector partners. We are grateful for Lyft as they are helping us to find solutions to help our neighbors without transportation to food access. I would also like to thank all our other private sector committee members as they are doing a terrific job. And in closing, I would like to share some exciting news that we are announcing that we will start home delivery efforts for those that are homebound. We are very pleased that Amazon has agreed to begin providing this service to us, to our most vulnerable residents. Starting this week, Amazon has begun delivering meals for MNPS and Connexion families who cannot get access to our community or school distribution points. We are piloting the program this week with 60 families, and Amazon has generously offered up to 2,000 food deliveries a week. At this time, I would like to close and recognize Vice President at Amazon and Second Harvest Board member Dave Alperson for his work on this committee and for all the work that he has done to make this possible. Dave?
Good morning, and thank you to Mayor Cooper, as well as Nancy and our partners at Second Harvest Food Bank of Middle Tennessee for all their work as we face this pandemic together. We believe that Amazon has a unique role to play, providing a critical service for customers and community members to get the goods they need for their families without leaving their homes. We're thankful for the opportunity to partner with Second Harvest Food Bank and the ability to utilize our delivery network to get shelf-stable foods directly to Nashville residents' homes who are disproportionately impacted by COVID-19. Nashville has warmly welcomed Amazon into the community, and we remain committed to being a good neighbor here in our second home. Thank you again to Mayor Cooper and the City of Nashville. Although the current landscape is challenging, we're proud to stand strong together. Thank you.
Thank you, Mr. Alperson. Thank you, Ms. Kyle, and thank you, Dr. Battle. We will now start the Q&A portion of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Stephen Elliott. Stephen.
Hey, thank you. I was wondering if Dr. Battle could discuss any progress she's made on requested budget cuts.
Question for Dr. Battle.
Thank you for that question. Just for clarity, I want to be clear that the work that Metro Nashville Public Schools has been doing in conjunction with the Mayor's Office and the Metro Finance team was for us to identify potentially up to $100 million cuts in our current budget. And with that information and request, we have been working on identifying non-personnel savings that we could capture if we do have a significant budget shortfall. And so we've been focused mainly on non-personnel expenses, savings that we can truly capture with our school buildings being closed. We are still in the process of creating and developing some scenarios. We have many different scenarios that we'll capture savings that get us at least halfway there and very much close to the $100 million request if needed. And so we continue to have those conversations. We most recently spoke with the Metro government team, finance team on yesterday. I'm continuing that conversations and really digging into the budget forecast. Thank you.
Nick Barras at News Channel 5.
Hey, Mayor Cooper, thanks for taking my question. I was hoping you could just give a little bit of perspective on whether a business is essential or non-essential. If they choose to be open and they do so by not allowing people into the establishment, but do so by curbside pickup, is that generally accepted as okay, regardless of whether or not it's perceived as essential or non-essential?
Mayor Cooper.
Thank you, Nick. I'll defer to Public Health and Dr. Jahanger. What is essential and non-essential is going to be hard. You for sure know essential, if that's food, healthcare, delivery, things that are essential for life going on. What ends up being non-essential is going to be also something explored as we get to a restart scenario for the economy in Tennessee. And you're going to phase, hopefully, all business back. But learning how to do it is curbside safe for retail goods. That's going to be something that I think public health is going to be looking at closely in the weeks ahead going forward as part of our restart protocols. Thank you.
Tosin Fakile.
Good morning. Thank you. I had two questions. The first has an A and B part. With the governor opening testing to everyone, how will Metro's 3 assessment centers meet this demand, and how will that affect supply by the turnaround? And my other question is, I know that there were a few inmates that were tested positive for COVID, and some people within the sheriff's the jail. I was just wondering what the plan is for handling that.
Dr. Jungir.
Sure. Thank you so much, Tosin. So regarding your first question about the governor, I'm really happy that the governor has now expanded access to testing to parts of our state that may not have had it. I'm also very proud of what we have done as a city to expand testing to our communities starting on March 31st by providing, in addition to what our health systems have already provided, which nearly 16,000 tests to this point, our city, through our community assessment centers, have provided 1,700 tests and have screened 2,400 people, and all free of charge. And if you've noticed, we have expanded our indications. Again, as science is driven, what we've done, we added new onset loss of smell, as well as new onset diarrhea this week alone, and have tested almost anyone that comes to our centers. Furthermore, we're doing this with almost no wait time. So we're meeting the demand of our community, and I'm really proud of that. Regarding the jail, we've, I believe the number is maybe, it said 5 or so individuals have been tested. And I spoke with Sheriff Hall actually yesterday evening on the phone, and they are following all the recommendations of American Correctional Association, as well as Dr. Caldwell's team and the public health, and they have all the PPE appropriately, and the testing that needs to happen, we're ensuring is happening to both the prisoners as well as the staff of the jail. And Sheriff Hall and I have had multiple conversations in the past 24 hours, and I know Dr. Caldwell and others have. So that's something we take seriously, and we'll continue to do so. Thank you.
Julia Palazzo. Julia, you're on the air.
Good morning, everyone. My first question is for Mayor Cooper. The Knoxville mayor, Glenn Jacobs, he released a 6-week plan for state's reopening, and I know you guys are still discussing necessary steps for Nashville, but do you anticipate drafting a plan or releasing it in full? And if so, when do you think you'll have that ready by? And then kind of a follow-up question, Dr. Jahanger, on the expanded testing. Do you foresee relaxing the protocol of calling the hotline first and then showing up? just to expand widespread testing a little bit more? Thank you.
Start with Mayor Cooper.
I appreciate what they're trying to do in Knox County. Every county, I think, there'll be announcements on this rolling out. It's going to try to roll out restart protocols. That needs to be in consultation with the health delivery systems to make sure that there's capacity, and it needs to be benchmarked and have thresholds on the amount of PPE testing, contact tracing, and then business operation protocols that get adopted. Obviously, the days ahead are, I think, the state and the counties are going to be concentrating on doing this in order to get the restart right. We can't do anything that has us undo the good work that has been done. But also for the moment, I know we're all very excited about this. We have additional cases. We had 65 additional new cases here in Nashville, even though we feel like the curve has been flattened. We need to get our cases really under control. And let me just do a little kind of pep talk for people in Nashville. Stay at it. Stay at it. The better job we do right now, the sooner we can get back and hopefully have a more relaxed set of protocols going forward. So let's stay at it. And two, let's also realize that this is not going away completely. You're not going to have a restart and we're going to go back to normal. You're going to have a restart and we're going to be adopting social practices that allow us to live with the presence of the disease in our community. And that's just the fact of it, and that's going to continue for a period of time. So everything will in time reopen, but we're going to have to reopen at least initially differently, and how each business and each industry does that is going to require close cooperation with the public health department in terms of having those practices be what they should be in order to prevent us from somehow backsliding back into the situation where we are now. Thank you.
And thank you for your question regarding if we expanded testing, what would it do to the hotline? I want to tell you this. 90% of patients who have COVID have shortness of breath, cough, or fever. Okay, the 10% additionally have either new onset loss of smell or diarrhea, new onset diarrhea, unexplained. Between those 5 symptoms, that essentially covers 100% of signs and symptoms that we know. We've let the science drive us on that. Our hotline helps guide people. As I mentioned, just yesterday we had 257 people call for a total of 4549. So 4,549 people have called our hotline. It's a great resource for our community. I'm so proud of the great the nurses who are working it in the public health department. Now, we are in constant communication with the state, and we'll evaluate. Like, do we need to further expand what we do? I mean, I've been the first to tell you if I thought we need to, and we quickly make those changes. And what that would mean for our hotline, we'll evaluate that as well. Right now, if you feel that you have the virus and you're worried about it, call our hotline, go to our assessment centers, and we'll make sure to get you taken care of. And then we'll just evaluate every step of the way what it would mean to hotlines and assessment centers as we amend anything we do. So thank you.
Harriet Wallace, Fox 17.
Yes, hi, good morning. I'm wanting to see, Mayor Cooper, if you could address, as Dr. Battle did, I know this is just a tough time for the city. There are 2 crises we're dealing with, but now we also have the looming budget issues. And I know that there's property tax, but then also looking at some areas where we can make cuts. And then also there's the potential of another year without the COLA. Could you please share how you all have been moving in terms of where you plan to cut, if you cut, and address the COLA issue? Will there be a COLA this year or not, or in the new budget year? Thank you.
Mayor Cooper.
Thank you, Harriet, for that question. And really to follow up on Dr. Battle's excellent answer earlier, let me just identify a big area that we don't know about in the city, and that is the federal help. I can't tell you directly how much federal help will be coming to our school system. It is or passing through the state, either directly or through the state. Without knowing that number, it is very hard to do a budget accurately. It's very hard for MMPS to know the resources that it's going to have. So the answer to that has to be prepared. So the school system is being prepared. The city's being prepared. We just don't know. I think in the Tennessean today was a wonderful article saying that the city is being allocated $120 million. That sounds like, well, that's great. That should go directly to us. The reality is that it does not. It is not allowed to replace spending that we would otherwise do, such as the school or the police department. It is only for new COVID-related expenses. So that adds a different challenge. It sounds like a glamorous number, but it is not really available to us to supplement funding for our current platform of services that we are delivering. So we're working all these days to try to bring in the number, of course, protecting our personnel and the platform of services for the government is our first priority to get through this in the budget, and we will do that. But being super expert and in getting all the savings that we can because we will need them, also that's something we have to be prepared for. So the shorter answer is we don't know, but we have to be prepared for possibly kind of the worst case where the federal and state response is much less than our revenue shortfall is going to be.
Ian Jong at the Tennessean. Ian, you're on the air.
Yeah. Hi, good morning. I had two questions that are sort of follow-ups from previous discussions, but in regards to Nashville data, I mean, can you provide any sort of number on how many of our cases are from asymptomatic people, whether that was through contact tracing, in which those people got tested for? And second, as you are, considering reopening scenarios, is one being considered in which maybe there would be a staggered reopening situation based on, say, zip codes and where maybe new hotspots might be, coming up?
Dr. Caldwell?
Good morning. Since our testing is primarily those who are symptomatic, we're really not testing people who are asymptomatic. So the proportion of those would only be in relation to our contact tracing, meaning first-degree cases of people that are positive. So very, very small minority. I'll ask Dr. Jahangir to answer your second question.
Regarding the reopening, as Mayor Cooper mentioned, I mean, there's Mayor Cooper Daley and I and others are thinking through this. It will be some kind of staged reopening with probably circuit breakers as to if something changes and capacity issues or incidence goes up. Whether it's zip code or not, I can't give you any direct information on that right now because it is still developing. But it won't be a all or none thing, as the mayor had mentioned. So more details to come as it develops. Thank you.
Chris Streckman.
Yes, good morning, everyone. Two questions for Mayor Cooper. One kind of on the essential, non-essential, and just people wearing masks, basically. Hearing from a lot of people, they're still going out and about. They're not wearing masks when they go pick up food or when they go to the gas station. So, Mayor Cooper, what is your message to those who aren't taking precautions? We know a lot of people are, but I'm also seeing even for myself when I go out, people are not wearing their mask. And then two, talking about, once again, unemployment numbers across the state, across the country. Once again, they're staggering, they're high. In addition to that, there are reports that the Small Business Rescue Fund set up by Congress has exhausted its funding capacity. So that being said, is there anything on a local level that can provide relief to families waiting for unemployment claims that may have not been processed by the state, and also businesses worried about staying afloat right now? What help is available right now locally? Thank you.
Mayor Cooper.
Well, Chris, we're hoping tomorrow to have a sort of teach-in on what small business and businesses can expect. It is the most challenging time I expect of my whole lifetime for business, and for employees who've been dislocated for that. The amount of help that we can give is very little directly from the city because we have our own terrific financial challenges. But we need to make sure that we're getting all the help that the federal government is able to offer us and to individuals. And then locally, to shorten the time of the coronavirus, particularly the economic disruption, is the best thing that we can do, which gets back to your earlier question about masks. We are all learning how to do this together. The probability is that we're going to need to have a mask option for a long period of time in Tennessee. Right now, we're urging people to wear masks. If social distancing is not being able to be invoked, there are going to be some times which you're simply going to have to be closer to other people as we go forward as an economy. And in that case, the mask has been determined by the CDC to be helpful in doing it. But we all have to learn this together. And also, for your audience, help us self-enforce. There's going to be nothing like other people looking at each other and saying, please wear a mask. The government is not going to be able to enforce every moment all the time, but we can help keep each other safe by accepting better public health practices.
Damon Mitchell, WPLN. Damon?
Hi, Chris. Just a follow-up to the testing questions. I'm just wondering, I'm guessing that there might be some confusion with residents as far as what the state is doing and what Metro is doing. So if people do decide just to come through a drive-through testing center this week or this weekend, are they going to be turned away, or how is the city going to handle that for people?
Thanks, Damon. Dr. Jungir?
So thank you for that question. So I just want to be very clear. The city community assessment centers are open Monday, Wednesday, and Fridays from 9 a.m. to 3 p.m. And they're located at Meharry Medical College, at Nissan Stadium, and at the old Kmart off Murfreesboro Road in Antioch. If you were to come to one of our centers in any of those times of operation, and specifically if you have the symptoms of cough, fever, shortness of breath, new onset loss of smell, or new onset unexplained diarrhea, you will receive a test. Everyone who shows up will be assessed, and all of that is done free of charge. If you have any of those symptoms, come. You can also go to your healthcare provider. If you like the state sites, and I defer you to the state website for their exact locations, they are open. There's 9 locations, if I remember, in the state open on Saturday, and 6 locations open on Sunday, and I defer you to the state site. Another great place to get evaluated. So there are resources for our community, whether it's our community assessment centers, whether it's your health systems, or whether it's the state assessment sites that are open on the weekends as per their site. So thank you.
Our final question comes from Kara Hartnett. Kara?
Hey, thank you for taking my question. Just clarification on the testing. Why can't Metro open up testing to residents regardless of symptoms like the state has promised? And will you be able to tap into the state's testing supply reserves?
Dr. Jungir?
Thank you. Great question. We're evaluating it. We're having discussions. We've expanded our indications over this week alone. If we expand our hours, and I want to highlight, there's no wait almost right now when you go to our centers. So we're meeting the needs of our community on the days we're open. Not to say things won't be amended, but if we do, then I think you're right. I mean, in my discussions with the state have been, we'll need to make sure we have the PPE. We need to make sure our testing supplies are up, and we need staff, right? We've been so fortunate to have great partners in our health systems and medical colleges that are providing free staff to us. Now, it's not free to them, but it's free to us to cover all of our community assessment centers. We're very grateful to have Hands-On Nashville as volunteers at our community assessment centers. So the state is using National Guard people to do their testing, and maybe that's something we talk about. But again, our community is being taken care of right now. 16,000 tests have been conducted in our city, and nearly 2,000 in our community alone by our community assessment system. So Not to say it won't, but we'll have those discussions. And you're right. I think it would have to be a partnership if it's a state wants an expansion. So thank you.
I'd like to thank Dr. Adrian Battle, Director of Metro Nashville Public Schools, Nancy Kyle, President and CEO of Second Harvest Food Bank of Middle Tennessee, and David Alperson, Vice President of Amazon Logistics, for joining us this morning. A recording of this morning's press briefing will be made available later today. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.